The first 1,000 days of life is critical to a newborn. The World Health Organization says this period is critical to the survival of any child, as several early life factors can contribute significantly to the child development and well-being. For Esther Oluwanifemi Oladapo, it was a torturous one. She was born ill and healthy, but had a high fever at 6 months and was treated for malaria.
I took her to hospital. They tested her, they ran a series of tests. They said it's malaria. After getting home, the temperature continued, not stopping. It was so hot to the extent, if she's breathing, the breathing is very hot. So I took her back to the hospital. They gave her drugs for malaria. But suddenly in the midnight, she convulsed. So immediately she convulsed, we rushed her to the hospital, exactly 3 a.m. So we rushed her to the hospital, getting to the hospital, she couldn't close her eyes. She was opening her eyes, she couldn't close it. But the doctor gave her an injection, private hospital. So from there, they ran some series of tests. They said the blood is already dried, that she needs blood, that we should go and get the blood. We get the blood, they continue the treatment, but we didn't see any improvement on that treatment. So we have to refer her to Mercy Hospital in Lagos Island. From there, we stay a month. So they discover, after running a series of tests, they discover that it's meningitis in Mercy Hospital. So they treated her. I stayed a month and some week in the hospital. Later, they discharged.
Esther is 12 years old today. She's not only paralyzed, she cannot talk and will be difficult for anybody to believe she is 12 years old. Her condition is worsened by the fact that she suffers recurrent seizures, a sudden attack occasioned by repeated convulsion. Esther Oladapo has been diagnosed of lumbar meningitis, an infection of the fluid and membranes around the brain and spinal cord. She also has cerebral palsy, a group of disorder that affects movement and muscle tone or posture caused by damage to the immature brain as it develops, most often before birth. However, fortunately, the good news is that Esther can be ill and healthy again with the help of stem cell treatment.
Any neurological condition that is not being treated, addressed at the acute stage, what I mean is within less than 3 months,
Okay.
Those conditions will require multiple sessions
Okay.
of stem cell therapy intervention
Okay.
in order to get meaningful results.
Okay.
But if let's say a stroke is being addressed within a couple of weeks, then the neurons that were programmed to die from the deficiency of oxygen to the brain
Okay.
are going to recover fully with stem cell therapy. So those will, as long as that person's blood pressure or the cause of the stroke is being kept under check,
Okay.
then there will be no problem from that particular incident.
Okay.
If the problem is being addressed after chronic or after 3 months or so, then one treatment session will not be enough to treat adequately that neurological disorder because the nerves are probably dead in most cases. So you have to stimulate the surrounding neurons of that injury area to start multiplying, differentiating, to take over some, if not all, of the functions that are deficient.
I see her walking again. I so much believe with what we have seen that people like her, though it's quite very expensive, stem cell treatment is not a joke. So with what we have done so far, we've been taught with testimony on her personally. We want to believe that those who have actually overcome through stem cell too should actually overcome, because the insertion will be directly to the brain, and the cells that have damaged in the brain will regenerate over time, and she will come out of it.
Health experts say with good treatment in a foreign hospital, Esther can live a normal life.
You want to take something? You want to eat something? You are focusing on the light too much.